Welcome to week 4 of the IV therapy course. We will be discussing calculation of the IV flow rate. We know that calculating the proper dose of medication is a critical aspect of administering medicine to a patient. Although the prescriber specifies a dose in the medication order, the dose prescribed may not be the same as the dose that is on hand, which will require the nurse to calculate comparable dose based on available medication. With intravenous medications, the prescriber might order a dose to be infused to the patient over a specific amount of time. The nurse must use the information to calculate the drip rate, which is used to set the IV so medication is administered at the proper rate. In this unit, the basic formulas for calculating drip and flow rates will be presented. Several YouTube videos will also be provided as additional learning resources. Rate calculation is included in the post-cannulation steps in Chapter 6. As a nurse authorized to administer IV therapy, it is essential that you understand the basic information to calculate both the flow and drip rates. While most infusions are delivered via an electronic infusion device, an EID, others may be delivered via a gravity infusion. When administering a gravity infusion, the rate of infusion is calculated in drops per minute. Keep in mind that when using an EID, an electronic infusion device, the rate of infusion is calculated in milliliter per hour. Factors to include in learning accurate rate calculations include the drop factor of the tubing, the authorized prescriber's hourly rate, and whether an EID, electronic infusion device, will be used to deliver the infusion. The amount of solution to be infused over the specified time can be obtained from the physician's orders. For example, 1,000 cc's over 12 hours at 125 cc's per hour. The duration of administration will also be indicated in the physician's order. There will be a time with it. For example, 500 cc's over 4 hours. It's also imperative to understand the drop factors of the available administration set. Macro drip sets are 10 to 20 drops per milliliter, and micro drip sets are 60 drops per milliliter. So for a 10 drop macro drip set, for every milliliter, there are 10 drops. And for 15, it's for every milliliter, there are 15 drops. And for 20, there is 20 drops per milliliter. And for 60, there are 60 drops per milliliter. The drop factor is provided by the administration set and is generally located on the side, front, or back of the administration package. Macro drop sets are used whenever a large amount of fluid is ordered to be infused over a short period of time, or the micro drip per minute requires too many drops, making it too difficult to count. In the next section, we will be discussing the calculation of flow rate and formulas. The volume or the amount of solution to be infused is found in the medication order, often in milliliters or in cubic centimeters, which is the same as milliliters. The amount of time over which the infusion is to take place is often measured in hours. To calculate the amount of solution to be infused per hour, divide the amount of solution by the number of hours. In this slide, for example, the amount to be given is 1,000 mils of solution over 8 hours. So 1,000 mils of solution divided by 8 hours is 125 milliliters per hour. This is the formula to calculate the drip rate per minute. After determining the milliliters per hour, we multiply by the drop factor and then divide by 60 minutes. Understand that the drop factor is specified on the IV tubing package that is used for the infusion. For test purposes, we will provide you with the drop factor information. That will be 10, 15, 20, or 60 drops per minute. Always express drops per minute in whole numbers. And always carry out to the 10th and round to the nearest number. The abbreviation GTT means drops. Again, IV fluids are most frequently ordered on the basis of milliliters per hour, abbreviated ML//HR, to be administered. For example, 3,000 mils over 24 hours, or 1,000 mils over 6 hours, or 125 mils per hour. Keep in mind that smaller volumes, usually containing IV medications, may be ordered in milliliters per minute. For example, 50 milliliters over 20 minutes or 10 milliliters over 5 minutes. Also, this may be used in pediatric or neonatal settings. When calibrating IV tubing, we will use a standard of a macro drip at either 10 drops, 15 drops, or 20 drops per milliliter. Again, that's calibrated in drops per milliliter. Depending on the manufacturer and type of tubing used, it will require 10, 15, or 20 drops to equal 1 milliliter in a standard macro drip set. Micro drip is 60 drops per milliliter, so it's calibrated as 60 drops to equal 1 milliliter in a micro drip. Let's do an example here. The order is to infuse the solution of D5W 2,000 milliliters to run over 16 hours. Your set calibration is 10 drops per milliliter. Please pause the slide video and complete the sample IV flow rate calculation on the slide using the information provided in previous slides. We will calculate this together and the answers will be provided next. The first step in calculating 2,000 milliliters in 16 hours is to express it in milliliters per hour to obtain a smaller volume. So 2,000 milliliters per hour divided by 16 hours gives us the rate of 125 milliliters per hour. Next, we need to calculate out the drops per minute. Enter the drops per minute being calculated first, followed by the equal sign, as shown here. In looking at step 3, know that we provided the information in the order for a 10 drop milliliter macro set calibration as our starting factor. That means that we will put 10 drops as the numerator here to match the drop numerator being calculated. In step 4, we match the milliliter denominator of the starting factor in the next numerator with the 125 mils volume ordered per hour. And we have converted 1 hour to 60 minutes as shown here. And the equation is complete. So we have drops per minute, which equals 10 drops over 1 mil times 125 mils over 60 minutes. Our final step is canceling the alternate milliliter units so that we can only have the drops per minute as our remaining value. So remove the milliliters because they cancel each other out. And then your equation is now 10 drops times 125 over 60 minutes, which equals 20.8. Remember, we have to round up to the nearest whole number, and our answer is 21 drops per minute, and that's what we were looking for. Let's take some time to practice a few exercises. The first exercise is calculating the flow rate in drops per minute. The order is for 500 milliliters of normal saline in 8 hours. The set calibration is 10 drops per mil. With this information, take the time now and pause this recording so that you can calculate out the drops per minute. Now, let's calculate this together. We want to take the 500 milliliters per hour here and divide it by 8 hours. So 500 milliliters divided by 8 hours is equal to 62.5 milliliters per hour, and I'm going to convert the hour and make it 60 minutes. Okay? Then I'm going to multiply that by the drop factor, 10 drops per mil. Remember, we can cancel out the mils. And then what we do is we take 62.5, multiply that by 10, and then divide by 60, and our number is 10.4. We need to round that to the nearest whole number, which gives us 10 drops per minute. Let's calculate the drops per minute for exercise 2. We're giving D5W 1,800 milliliters to be infused in the next 15 hours with a 15 drop per mil set. Please pause and take the time to calculate the drops per minute for this exercise. Okay, doing what we did before, we took the 1,800 mils divided by 15 hours, which gives us 120 mils, converting the hours to 60 minutes. We multiply that by the drop factor of 15 drops per mil, canceling out the mils again. So then you take the 120 times the 15, divide that by 60, and you get 30 drops per minute. Our next example in exercise 3 is calculating the drops per minute for a patient who is receiving 4,000 milliliters of D5W in the next 20 hours using a 20 drop per mil macro set. Please pause now and calculate this out. Okay, again, we take the 4,000 mils and divide it by 20 hours, and you will get 200 mils over 60 minutes, again converting the hours to minutes, multiplied by the 20 drops per mil, canceling out the milliliters, and you get the answer of 66.7, which you must round to the nearest whole number, which is 67 drops per minute. Okay, one more practice exercise, number 4, again, calculating the drops per minute. We're infusing 600 milliliters of intralipids in 6 hours with a 10 drop per mil set. Again, pause and calculate, and then we will review. Okay, take the 600 mils and divide it by the 6 hours, and you will get 100 mils, converting the hour to 60 minutes. Multiply that by the 10 drops per mil, and you will get 16.7. Again, rounding to the nearest whole number, you get 17 drops per minute. Now we will talk about large volume drops per minute form in milliliters per hour ordered. The order is to infuse a solution of D5W at 110 milliliters per hour using a calibrated 20 drop per mil macro set. First step, we enter the drops per minute being calculated first, followed by an equal sign. Enter the 20 drop per mil set calibration as the starting factor, with 20 drops as the numerator, as shown below. Then we will match the milliliter denominator of the starting factor in the next numerator with 110 ml volume ordered per hour, converting the hour to 60 minutes. So you will get 20 drops per mil here multiplied by 110 mils over 60 minutes. You can cancel out the alternate milliliter units so that you only have the drop per minute calculation. And the result will give you 36.6. Again, we have to round to the nearest whole number, so our answer is 37 drops per minute. Okay, here are some exercises to calculate the flow rates in drops per minute utilizing the process we just went over. We will give you the answers after you pause and calculate them out. Okay, for all three of them, remember to convert the hour to 60 minutes. So it's 100 mils over 60 minutes for the first one times 15 drops per mil. Cancel out the milliliters. And then you will get 25 drops per minute as your answer by taking 100 times 15 divided by 60, and that gives you 25 drops per minute. For the next one, you will take the 80 mils over 60 minutes times the drop factor of 20 drops per mil. Cancel the milliliters, and that gives you 80 times 20 divided by 60, which equals 26.7, which you have to round to the nearest whole number, and that should give you 27 drops per minute. Then, for the final one on this slide, you have 90 mils per hour. So again, writing 90 mils over 60 minutes times 15 drops per mil as your drop factor set, which equals 90 times 15 over 60 gives you 22.5, again converting to the nearest whole number, 23 drops per minute. Many IV medications are ordered diluted in a small volume, such as 100 milliliters or less of IV fluid, and administered by gravity flow, most frequently using a volume-controlled burette. An example would be a volume of 100 milliliters to be infused in 40 minutes. And then we will be using the 15 drops per mil set. So we want to calculate again the drops per minute flow rate. So the first thing you want to do is, we know that we want to get drops per minute, so that is what our equation is going to be. Then begin as if you are calculating only the drops, the numerator. Locate the factor in the problem which contains the drops, which we know is the 15 drop per mil set calibration. Enter this as the starting factor with drops as the numerator being calculated. Don't worry about the minute denominator being calculated because everything will fall into place. So this is how we're going to write it. 15 drops per mil. Then we calculate the denominator of the starting factor as milliliters. The numerator of the next factor entered must be milliliters to match. Look at the problem and you will find that the order is to infuse 100 milliliters in 40 minutes. So we do 100 milliliters over 40 minutes is our denominator. Now that our equation is complete, we can calculate it out. Notice how the minutes denominator being calculated fell into place as the factors were entered. We cancel the alternate denominator and numerator milliliters, leaving us with drops per minute. Then when we do the math, 15 times 100 divided by 40, we get 37.5. However, we need to round to the nearest whole number, and that gives us the 38 drops per minute, as shown here. And that would be the rate for our infusion. Now take the time to practice these exercises. And then after you have done that, return to the slide and we will review. Okay, for the first one, we calculate using a 10 drop per mil set. So you take 10 drops per mil times 75 mils in 5 minutes. And you should obtain the rate of 150 drops per minute. With the next one, an 80 mil volume in 50 minutes using a 15 drop per mil equation, you would take 15 drops per mil and multiply that by 80 mils over 50 minutes. Remember to cancel out your milliliters, and your answer should be 24 drops per minute. For the third one, you have a 20 drop per mil set, and you're infusing 40 mils in 20 minutes. So 20 drops per mil times 40 mils over 20 minutes. Cancel out your mils, and you should get the rate of 40 drops per minute. Okay, for the fourth one, you do the same procedure with 10 drops per mil times 20 mils over 20 minutes, and you should get the answer of 10 drops per minute. And finally, using the same procedure, you have the 60 drop mil set times 30 mils in 40 minutes. And that gives you, again, canceling out the milliliters in the numerator and the denominator, that should give you the rate of 45 drops per minute. Now we're going to move on to discussing regulating the flow rate. The flow rate is regulated by counting the number of drops falling in the drip chamber. The standard procedure for doing this is to hold a watch next to the drip chamber and actually count the drops for 15 seconds while using the roller clamp to adjust the flow rate to the desired drops per minute. For example, if the required rate is 41 drops per minute, you would adjust the flow rate to 10 drops in 15 seconds. 41 divided by 4, once you round it, is 10. So 10 drops per second is as close as you can get. Let's take some time now to practice doing the 15-second drip rates. The reason we use 15 seconds is because when you multiply it by 4, that gives you 1 minute. Pause the video at this time and then calculate the next few questions. So let's review the first one. The 15-second count of an IV flow rate is 6 drops. And we're trying to obtain a 29-minute drop per minute rate. Is that correct? So you would take the 29 drops per minute and divide that by 4. And that equals 7.25, which we need to round to 7. So the answer is correct at 7 drops. The next question is, we are regulating a newly started IV to deliver 67 drops per minute. Again, using the 15-second count, how would you set the flow? Utilizing that information, 67 divided by 4, and that equals 16.75, which we have to round, and we should get 17. For the third question, we want 48 drops per minute. So what is our 15-second drip rate? Take 48 divided by 4, and we get 12. Sometimes there's a need to correct off-schedule rates, so we will now review that. This is our scenario. An IV of 1,000 mils was ordered to infuse over 10 hours at a rate of 25 drops per minute, utilizing a 15 drop per mil calibration set. After 5 hours, a total of 650 milliliters has been infused, when we would expect to have 500 mils. Because if you look at the original order, 1,000 mils over 10 hours, and 5 hours here is half of 10, so you would half the 1,000, so you would expect that only 500 milliliters had been infused. So now we need to recalculate the new drops per minute flow rate to complete the infusion schedule. First of all, we have to determine how much time is remaining. We know that we are 5 hours in, so 10 hours minus the 5 hours in gives us 5 hours. The volume remaining, we take the starting volume of 1,000 milliliters minus the infused volume of 650 milliliters, leaving us with 350 milliliters of volume to be infused. Okay, so again, going back to what we've learned already, we want our drops per minute, and we know that we have a drop factor of 15 drops per mil. We multiply that by the volume to be infused, which is 350 milliliters, over 5 hours, which we convert to 60 minutes. Okay, cancel out the milliliters, cancel out the hours, and you now get 15 drops times 350 over 5 times 60, which calculates out to 17.5. Again, we have to round to the nearest whole number, giving us 18 drops per minute. Now it's your turn. We have an IV of 800 milliliters to be infused over 8 hours at 20 drops per minute. After 4 hours and 15 minutes, there's only 300 milliliters that has been infused. Recalculate the drop per minute rate to complete this on schedule. The set calibration is 15 drops per minute. Calculate this out and then move to the next slide. So we know that we originally started with 8 hours, and we have completed 4 hours and 15 minutes, and 15 minutes is 0.25 of an hour. So 8 hours minus 4.25 hours leaves us with 3.75 hours. We started with 800 milliliters and have infused 300 milliliters with volume to be infused of 500 milliliters at this time. We must get the drops per minute. So we know in the previous slide it stated that we had a 15 drop per mil set. Multiply that by the volume to be infused, which is the 500 mils, over 3.75 hours. Again, we have to convert to minutes, so we multiply 1 hour over 60 minutes here, we cancel out the milliliters and the hours, and then you'll take 15 times 500 times 1 divided by 3.75 times 60, which gives you 33.3. Again, we have to round to the whole number, and that gives us 33 drops per minute. Now let's practice another one. An IV of 500 milliliters was ordered to infuse in 3 hours using a 15 drop per ml set. With 1.5 hours remaining, so you're halfway through, you discover that only 150 milliliters is left in the bag. At what rate will you need to reset the flow? Okay, so let's work this out. We know that for our time, we originally started with 3 hours, and we have 1.5 hours remaining. So 3 minus 1.5 gives us 1.5 hours. And then we know that our volume to be infused less is 150 milliliters based on the information provided. So we don't need to do any further calculation there. So we want to get drops per minute. So we take the 15 drop per ml set times the volume to be infused, 150 milliliters, over 1.5 hours, which we need to convert to minutes, so 1 hour over 60 minutes, okay? Remove the common numerators and denominators, and multiplying 15 times 150 divided by 1.5 times 60 should give us the answer of 25 drops per minute. Let's try another one. An IV of 1,000 mils was scheduled to run in 12 hours. After 4 hours, only 220 mils has been infused. The set calibration is 20 drops per mil, so we're going to recalculate the rate for the remaining solution. So let's work this through together. Pause now, calculate this out, and then we will go over the answer. Okay, so we know that our starting time was 12 hours minus what we have already spent is 4, so that leaves us with 8 hours. Our volume to be infused, we know that we started with 1,000 mils minus 220 mils, which gives us 780 mils, and I'm calculating as we go along. Okay, so let's set up our calculation as drops per minute, and we will take the calibration of 20 drops per mil times 780 mils over 8 hours. Again, we have to convert the hours to the minutes. So we're going to cross multiply and do all the division. Factor out the common numerators and denominators, so the mils and the hours. And then you're going to multiply 20 times 780 divided by 8 times 60. When you calculate everything out, again, 20 times 780 over 8 times 60, you should get 32.5, which we need to convert to the nearest whole number, so 33 drops per minute. Let's do another problem. An IV of 1,000 milliliters was ordered to be infused over 8 hours. With 3 hours of infusion time left, you discover that 600 mils has infused. The set delivers 20 drops per mil. Recalculate the drip rate and indicate how many drops you will count in 15 seconds to set the new rate. So there's going to be 2 parts to this problem. So you'll be getting 2 different answers. The first answer you will get is recalculating the drip rate, and then you will do the 15-second count rate to set the new rate. Pause now and calculate. Okay, let's calculate this out together. So let's figure out how much time we have left. And in the problem, it stated that we had 3 hours left. And then our volume to be infused at this time, we know we started with 1,000 milliliters. And we know that 600 has gone in, so that leaves us 400 milliliters to be infused. We want the drops per minute. Okay, and we know that we have a 20 drop per mil set. We multiply that by the 400 milliliters, our volume to be infused, over 3 hours. Again, we have to convert the hours to minutes, so 1 hour over 60 minutes. Removing all the common numerators and denominators. So you will multiply 20 by 400 and then divide that by 3 times 60. And that gives you 44.4. Again, we have to round to the nearest whole number. So that is 45 drops per minute. Then, in order to recalculate the drip rate in the 15 seconds, we're going to take the 45 that we just obtained here and divide that by 4, which gives us 11.25. Again, rounding to the nearest whole number, 11 drops in 15 seconds. So now we're done practicing calculations for a little bit, but I did want to review that there are certain factors that affect flow rates. There are multiple factors that can influence the administration of IV fluid and medications. For example, starting with body surface area, we often use this in pediatrics and critically ill patients. The BSA, or body surface area, is expressed in square meters and is used to calculate pediatric dosages, managing burn patients, and determining radiation and chemotherapy doses. You will not be using this method in this course, but just understand that the body surface area is one of the many factors that it can influence the therapy. Of course, patient condition is another factor that can influence IV therapy. The presence of disease or previous surgical intervention could limit venous access, or if a patient has a condition with poor vascular venous access, which could result in making IV initiation difficult. Always avoid the arm that has been affected by disease. An example of such conditions are stroke, a mastectomy, amputation, orthopedic surgery of the hand or arm, and plastic surgery of the hand or arm. The presence of a shunt or graft. Never use a patient's arm or hand that has a graft or shunt for dialysis. And then a patient receiving anticoagulation therapy is another patient situation that needs consideration. Complications related to local ecchymosis and major bleeding can be avoided if the nurse is aware that the patient is taking anticoagulation therapy, such as Coumadin. Age is another factor. As an LPN that is soon to be authorized to practice limited IV therapy, you can only initiate IV therapy on adult patients who are 18 years of age and older. In Unit 2, you learn that as people age, the body goes through wear and tear. The vascular system is part of that. Older adults, such as those 65 and older, usually have fragile and small veins and should approach venipuncture gently. The nurse should evaluate the need for a tourniquet when inserting an intravenous needle. The composition of the IV fluid is another factor. As an LPN with limited IV therapy practice, there are specific and limited IV fluids you can administer. Crystalloids such as 0.9 normal saline is an example. These allowable solutions, as specified in Chapter 4723-17 as reviewed in Chapter 2, requires the nurse to have the knowledge to the movement of the IV solution. You learned in that unit, in Unit 2, that depending on what solution, hypo, hyper, or isotonic, can move in and out of the cell or stay in the vascular space. In addition, when administering irritating fluids, such as certain antibiotics, it is preferred to select a large vein in the forearm to initiate this therapy. You must also consider the patient's tolerance to the initiation of the IV as well as the infusion, and any factors and changes in blood pressure, because lower blood pressure will make it more difficult to start an IV. Finally, other factors to consider are the height of the container. It is recommended that the IV bag should be hung 3 feet above the site to ensure appropriate flow of the fluid. Potential occlusion of the tubing or lumen could also cause erratic flow or delay IV therapy treatment. And we just discussed calculating and recalculating flow when we're not meeting the targeted volume to be infused in the amount of time ordered. Faulty regulator clamps could cause serious injury to the patients related to over or even under infusion. Cold infusion could cause vasospasm resulting in pain and discomfort to the patient. So that would be the cold fluid. Trauma to the vein could cause infiltration. The fluid could be infusing in the skin instead of the vascular circulation. Clogged air vent, and this applies to the glass delivery system particularly. If the air vent is clogged, the infusate will not flow, causing a delay in administration of the IV therapy. Ensure that the vent is open when using a glass system, especially for secondary infusions such as antibiotics. And finally, we address the change in the cannula position. So that is the actual tubing that's the cannula that's in the patient's IV site. If that gets occluded, that can factor flow rates. This is the end of Module 4.